and welcome back to this episode of This Healthy Life podcast. I am so excited and honored for my guest today. I have Dr. Richard Horowitz, which is one of the top Lyme doctors in the world, and he is here to share his wisdom. We're going to be kicking off Lyme Disease Awareness Month, and as many of you listeners know, I've struggled with Lyme since 2012. Thankfully, I've been in remission since 2017, but this is a topic that is very near and dear to my heart and want to get as much information out there as possible to help those that are still dealing with Lyme. So Dr. Horowitz, thank you so much for joining us today. I'm so honored to have you on the podcast today.
Oh, it's my pleasure. I'm glad to be here.
Amazing. So I'd love for you to start just with a brief intro about yourself. I know you've been in practice for over 30 years. You've successfully treated over 13,000 patients. So you have just a wealth of knowledge of Lyme and what's going on and what works for patients and what doesn't. So excited for you to share your wisdom today.
Yeah, it's actually been 41 years. I mean, It goes very quickly that I've been in medical practice. And I think many people do know my story, but essentially, I'm a board certified internist. I was not planning on treating Lyme disease as my primary specialty. But when I finished my internal medicine training in Mount Sinai in New York City, I moved upstate to the Hudson Valley. And in Dutchess County, New York at the time, I didn't realize I was moving into the largest Lyme epidemic in the United States at the time. So, these people were coming in with EM rashes, 75 roughly percent would get better with antibiotics, 25 30%, 35% wouldn't. And I used to send them to neurologists, infectious disease doctors, rheumatologists. I sent them all over to try and get help. No one knew what to do for these people. So I remembered the teachings from my spiritual teacher, Lama Gendon Rinpoche, when I was finishing medical school in Belgium. I had gone to him my last year of medical school. It was 7 years, by the way, in French. That was a whole nother story. And I asked him, I said, Lama, what's the most important thing you want me to know when I go out in the world as a doctor? And he said, Richard, the most important thing is exchanging yourself with others. Do for others what you would want done for yourself, and everything will go well. And interestingly enough, that piece of advice really served me well over the years, because as patients kept coming in, they might get better from my first treatment, were Babesia, but they were still ill. I never gave up. I just kept looking for answers. And now 40 plus years later, I've developed a 16-point model called the MSIDS model, multiple systemic infectious disease syndrome. And basically what this model found is that the people that are sick with Lyme have much more than Lyme disease. They have other infections. I refer to them affectionately as the 3 Bs, Borrelia, Babesia, and Bartonella, because they're showing up in the vast majority of people. But people are also getting viruses. If they have long COVID, they're reactivating Epstein-Barr and herpes virus 6. They may be getting other parasites. Fungal infections, mold is getting into people with environmental toxins. The microbiome of their gut is off, where they have the wrong bacteria, viruses and fungus causing inflammation. They have leaky gut and mast cell disorder. In other words, they've got all these different sources of where the inflammation's coming from. And if you don't get to where the inflammation's coming from, these people just don't get better. So the 16-point model has served me well. And, during the last roughly 10 years, I've developed a very short-term oral generic protocol called Dapsone Combination Therapy for treating Lyme, based on the fact that this bug is kind of like TB and leprosy. It's a persister biofilm bacteria. And I've been very happy. The results have been really fabulous in some people. And we've now applied for a randomized controlled trial to see if we can prove this to the world.
Amazing. Yeah, I love all the research that you're doing and so many ways that you're helping people. And I'm glad that you brought up that topic. So many people like to say oh, I have Lyme, but like you said, it's a whole bucket of things, commonly the co-infections, which are the most common ones that people know about. But of course, all these other things that kind of go with the package, right? Like the viruses and the environmental toxins and the mold and all that. And unless you're addressing every single kind of piece of that puzzle, like you said, you're really going to struggle getting better. And because it's kind of like whack-a-mole, right? You're fixing one thing and one other thing goes haywire, and really is kind of a whole package, unfortunately.
Yeah. The thing for people to know, though, is even though when I talk about these 16 points, and I, sometimes talk about someone goes into a doctor's office with 16 nails in their foot and says, I have foot pain. The doctor only finds 1 or 2 nails, pulls it out, says, come back in a month, tell me how you're doing. We know you're still going to have foot pain. Interesting, though, even though there are 16 points, the most important things I've now found that really are responsible for most people's illness are the 3 Bs. It's Borrelia. You've got to use biofilm persister drug regimens like Dapsone Combination Therapy to get rid of it. We're not sure it's a cure in humans, but I will tell you, my wife is now 7 years in remission. Wow. I have many people years in remission from a very short-term oral generic protocol. It's no long-term antibiotics. But you've got to hit the parasites like Babesia. Babesia has now become resistant to standard treatments like Mepron and Zithromax that used to work years ago. And Bartonella, cat scratch fever, which there's 18 different pathogenic species of BART, is showing up in at least 90% of my chronic glial patients with mold toxins. So, and I would say even long COVID is kind of not far behind with this. So even though mitochondrial dysfunction and hormone dysregulation, like low adrenal function, POTS dysautonomia, low blood pressure, when you stand up, you get dizzy. Some people feel like they're going to pass out. Even though you have to go through all 16 points, once you have treated the 3 Bs, Borrelia, Babesia, BART, and you've removed the mold toxins, made sure they're not immunodeficient, because 20% of my patients have chronic variable immune deficiency. Their immune system is not working at all. They have to do subcutaneous immunoglobulin therapy or IVIG. Long COVID, they can get T cell exhaustion. The fact is the 3 Bs in mold is kind of showing up at the top of the list. And once you've gotten those, yes, the hormones are important. Yes, POTS is important. Leaky gut and mast cell is important. Getting to sleep is important. Healing your trauma from PTSD is, all of those are important. But I will tell you, those are the mold and the tick-borne infections with the 3 Bs are kind of showing up at the top of the list, and especially mold. Once we get rid of the mold, Dapsone Combination Therapy turns out to be much more effective in people. So, I felt after 10 years I published 9 articles, and Tufts published the 10th, where they showed in the mouse model that rifampin and dapsone, what's used to cure leprosy, cures Lyme in the mouse. They cannot find any more infections. As I said, we now have people for years in long-term remission, no more long-term antibiotics, no more long-term herbal therapies. It really gives hope to the Lyme community. And the next step is really an NIH-controlled study. But of course, the irony is I spent 4 months submitting an NIH R34 planning grant with EVA, a consulting company in North Carolina. And within 2 weeks of submitting it, the federal freeze took place. So now I may have to look for other funding.
Oh, man.
We'll see.
Bad timing.
We'll see how this goes by the end of the year. But
Yeah.
I'm sure I will get funding from somewhere, because I think the Lyme community knows that I have so many, in fact, success stories at this point. And in fact, the Healing Lyme Summit, which aired April 15th to the 22nd, we're going to have our second Dapsone documentary with 9 more people telling their healing stories. Last year, and I know you're going to share the link for people to look at. Last year, we had 18 people discussing their healing stories. So what's great is that, you can read the scientific literature and read about things that look effective. But when you hear people's stories, hey, I've been sick for 30 years. Now I've got my life back. The stories, I think, are much more potent in really telling the story of how important it is to address biofilms and these persistent infections, which are biofilm persister infections. And honestly, we didn't know that until 10 years ago. Thank God for Johns Hopkins University and Stanford, and Eva Shoppe from the University of New Haven, Kim Lewis at Northeastern, all these great researchers. They have paved the way for me to be able to find the protocols that I have found effective.
Mm-hmm. Amazing. So let's get into Dapsone a bit, because I think there's going to be a lot of people out there that have heard the word but aren't really familiar with exactly what it is and how the protocol works. Can you kind of walk us through what the Dapsone therapy is like, what it is, and how this was working on Lyme, Borrelia, and Bartonella? Borrelia, Babesia, and Bartonella. I don't know.
Dapsone is a very old drug that's been used to treat leprosy. It's at least 50 years old. And they knew that you had to give rifampin and Dapsone for 1 year to cure leprosy. In fact, that's how I came up with the protocol. About 10 years ago, Johns Hopkins researchers showed that Lyme disease, Borrelia burgdorferi, was a biofilm persister infection. And what that meant was not so much just that the infection persisted in the body. We knew that before because we were finding it inside the cells, or in what are called S forms, L forms, cell wall deficient forms. What we didn't know is that it had these biofilm persister forms where it goes dormant and goes to sleep. So the minute you stop your herbs, the minute you stop your antibiotics, there's this thing called quorum sensing. The bug knows that, hey, nothing's around to kill me anymore. And it comes out of hiding and it starts, waking up and causing you to be ill. So all I really did was look at the qualities of Dapsone. And when I looked at what Dapsone did in the body, number one, it's anti-inflammatory. So we all know that the reason someone stays sick from chronic Lyme disease, or in fact, all the chronic diseases we're talking about, chronic fatigue syndrome, myalgic encephalomyelitis, fibromyalgia, autism spectrum disorder, Alzheimer's, it doesn't actually matter what disease we talk about. It is all driven by inflammation. Dapsone is a very potent anti-inflammatory. And a couple of years ago, they even showed that it helps stop Alzheimer's going forward. So this was a big Korean study that was done in thousands of people who they were followed for like over 15 years. So they even had a double-blind placebo trial in 201 patients showing it helped people with neurocognitive impairment. So it's anti-inflammatory. Number two, has fabulous penetration into the brain. So I have not had to use IV Rocephin, ceftriaxone, in years. I used to use it for neurological Lyme. No more IV drugs in my practice. The last time I had to use it was somebody who came in with a Bell's palsy who had failed doxycycline early on in the illness. He actually had a Borrelia species from the Midwest called Borrelia mayoni instead of the bullseye, typical bullseye, which, by the way, half the time doesn't look like a bullseye. It's a solid spreading rash that could be confused with a cellulitis, a skin infection, or a spider bite, or even herpes zoster, shingles.
And that's if you're lucky to even get the rash, right? Like, I think only about 25% of people get the rash.
Correct. I mean, they say, if you read like sometimes the CDC site, they'll say 70, 80%, and it's not true. You're right. It's in my study when I did it, it was like 20% of the people with chronic Lyme saw the rash. So yes, you're not always lucky that you've seen it. But the thing about Dapsone is great penetration in the brain, anti-inflammatory, anti-malarial. So if people had Babesia, about 25% of the people who take Dapsone, their Babesia gets better. The beauty is it's also a persister drug and hits these biofilm forms. So the only other persister drug that has ever been published in the medical literature for Lyme is disulfiram, which is the alcoholic drug, which came out of Stanford University research by Dr. J. And Ken Liebner had published on it. And just about 2 weeks ago, Columbia University researchers published in 9 patients that, I don't know why that's all they could get to enroll in the study, but 9 patients enrolled. 6 of them had to drop out because the side effects were so severe. 1 was hospitalized, and they found like liver function abnormalities, neuropathy, psychiatric issues. The 3 that did continue it did get some help. I now know, and I know this from speaking to Ken Liebner and because of my work, lower dose disulfiram does help, but you have to be on it from months to years. Dapsone is like 9 weeks. And it's like cancer chemotherapy. I tell people who do this is not an easy protocol, but it's well worth it.
The Dapsone or the disulfiram? Which one?
Well, actually both, but Dapsone, because Dapsone will cause a temporary anemia. It interferes with folic acid metabolism, so you get a temporary anemia that always goes back to normal when you're done. But you can lose about 4 grams of hemoglobin during, sometimes even a bit more. So if you start with a hemoglobin of 14, you might be 10 by the time you finish Dapsone at double dose. It might be 8.5 or 9 with quad dose, which is needed for Bartonella, and finishing with it. But it always goes back to normal. But the doctors and the patients have to get used to the fact that you get anemic. What's ironic about it, by the way, the first patient I ever gave Dapsone to, I looked at her bloods. She was quite anemic, and I was scared. I got on the phone and I went, "Oh my God, how are you doing?" And she said, "Great." And I went, "Hold on, you're very anemic. How are you feeling?" She said, "Oh my God, doc, I have more energy than I've had in the last 50." It's like, what? So it's funny because even though people get anemic,
that
by
Lyme fatigue is worse.
The bug and the inflammation, they feel better. They also get a side effect called methemoglobinemia, where you don't carry oxygen as well in the blood. But I discovered over the years, the way you reverse the side effects is using a drug called methylene blue. Interestingly enough, methylene blue also hits these persister forms of the bacteria while lowering methemoglobin levels. And I'll use things like glutathione, vitamin C, vitamin E, NADH, nada, cimetidine, an old drug for the stomach, lowers methemoglobin. And by the way, this entire protocol can be found in the microorganism article I published in September 2023. It is free. You can go online. Any doctor can read this and can find the full, like it's a cookbook. I basically tell people how to do it from step 1 to A to Z. And I know I gave you my medical detective Substacks, which are free. They come out once a week. The full protocol in detail of how to do this is in the Bartonella Substacks that I published about a month or 2 ago. So I know you're going to share this with your listeners. It honestly couldn't be easier because it is like following a cookbook. You just have to get a doctor who's been either trained by me, who reads the literature and is willing to do it. But I will tell you, it is the #1 treatment I'm using now in people that come into my office with chronic Lyme, and our success rates are very high. The only ones we have difficulty with where they don't get like immediately better or they get better but still have work to do are the ones with mold. or the ones with resistant Babesia, where Bartonella requires multiple 2-week pulses of these antibiotics. That's the reason why we're really having most of the problems, as long as I said, as the adrenal hormones and the sex hormones, testosterone's been dealt with, and you've done Limbic retraining for your POTS dysautonomia, and you've dealt with the mitochondrial dysfunction and leaky gut and mast cell. But, as long as you follow the 16-point map and you keep having a checklist, have I checked this? Have I made sure like I've addressed this properly and tested for it? People will get better. There really, really is hope. We're more effective in treating this disease. 10 years ago, we were kind of clueless, but 2016 was the first time I published the Dapsone article. And every year we've tweaked the protocol, and it's just gotten better and better. Oh, and by the way, the last thing that Dapsone does, which also happens in Lyme, is autoimmunity. You get all these autoimmune reactions, just like you do with long COVID. And Dapsone also is used for autoimmune disease. So it's kind of like this drug. It works on so many aspects of Lyme. I knew when I was going to use it the first time, I knew it was going to be effective once I looked at the qualities of the drug. And when you add rifampin, it's even more effective. You add doxy or minocycline to it in culture now with biofilm persister forms, even more effective. You add Zithromax, the fourth drug, even more. So what the studies have shown is a 4-drug regimen is better than 3 drugs better than 2 drugs better than 1. But it's a short-term 9-week protocol followed by 2-week pulses. And in between the pulses, most of the time, we're now detoxing people from mold, addressing the hormones, their POTS. That's kind of how this is going for the most part for most people who come to us.
Great. So do people tend to have to just do like one 9-week protocol, and that seems to be enough to kind of clear some of these infections and the inflammation, or are you having to do multiple rounds of it?
Well, the only people that are going to get well from a 9-week protocol are the ones who don't have active Babesia Bart and the ones who don't have mold.
Gotcha.
So most of the people, because they do have those, what we usually see is like there's an unlayering of the illness, like peeling an onion. So like if you started at 20% of normal, you might get through the first 9-week Dapsone protocol and you have to wait, by the way, 1 month, 4 to 6 weeks after it's done, you get your new baseline. You cannot evaluate how you're going to feel until at least a month after. But most people will say, hey, doc, I was 20% normal. Now I'm 50, 60, 70% normal. Then when we're done with the Dapsone and we're giving them high dose folic acid to reverse the anemia, and then we're, let's say, treating the mold, we're giving them mold detoxification, treating the hormones. We'll do that for like 2 months. If we found that Bartonella is active, we will then stop the mold detox and do a 2-week pulse of high-dose Dapsone combination therapy, which is now only 6 days of high-dose Dapsone, 400 a day. And we do that, we need a minimum of 4 pulses. So roughly every 2 months, we're doing a 2-week pulse. A minimum of 4 pulses are needed for chronic Bartonella. We have seen people need 7 to 8 pulses, depending on how their immune system is, how much mold they have. But ultimately, once the mold is gone, I will tell you the treatments are way more effective. And I used to joke with Neil Nathan, who's, a mold expert, and I interviewed him and Jill Christa at the Healing Lyme Summit. And, we used to joke because Neil would say, oh, mold's getting into everybody. It causes the same symptoms. Say, come on, Neil. And I will tell you, he was absolutely right, because now it's gone on. Mold causes every symptom we are seeing in these chronic tick-borne disorders, and it suppresses your immune system. So whereas Lyme affects your immune system and Bartonella affects your immune system, causing immune deficiency in some people, as well as POTS dysautonomia and neuropathy and neuropsychiatric issues. We have to be careful, because when you get long COVID affecting your T cells and then your B cells making antibodies, you're affected, you need a healthy immune system to get rid of these bugs. And I don't know that most doctors are actually adequately checking the immune system of these people, which is in part why these protocols may not work as efficiently.
Yep. Yeah, that's definitely something that I found in my own journey. It's like at a certain point, it's like you're killing, but at a certain point, it's a matter of fixing your immune system and getting that to kind of function properly and getting rid of that inflammation at a certain point, right? Like you kind of have to really shift gears and work on that. So I want to touch on the autoimmunity. So you brought that up. Like I myself, after Lyme, I developed, I think, 3 autoimmune diseases because of it that I'm still kind of managing. So how are you seeing that Dapsone is helping the autoimmune conditions that people kind of trigger on during Lyme? Is that something that they're able to put into remission or get a lot of that chronic inflammation down without continuing being on Dapsone constantly? Or does that inflammation start to kind of creep back in once you're done with your rounds of it?
So the inflammation, especially from the autoimmune aspect. So Lyme patients will always, almost everyone gets antithyroid antibodies, antithyroid peroxidase, no, I mean, I can tell you.
I got Hashimoto, celiac, and alopecia were mine.
So antithyroid antibodies, antithyroid peroxidase, antithyroid glype, almost everybody. A lot of these people will get antiganglioside antibodies when they have neuropathy. So if you have the tingling, numbness, burning, stabbing, usually antiganglioside antibodies will be present. Same thing with POTS dysautonomia, because the autonomic nervous system, the part of your body that controls your blood pressure, your heart rate, your bowel, and your bladder, also gets affected by Lyme, Bartonella, mold, long COVID. So you'll see those autoantibodies, but you'll also see anti-nuclear antibodies being positive in many. You'll see rheumatoid factors being positive, but they don't have rheumatoid arthritis. The way you differentiate a true autoimmune disease from just autoimmune manifestations with these markers is if you do a CCP, a cyclic citrulated antibody, that is the antibody for true rheumatoid arthritis. Now, understand, you can have a true autoimmune disease and still get a tick bite. Like I've had people with true rheumatoid arthritis who failed drugs like methotrexate because the tick-borne disorder was not being addressed. And the way I knew they had it is the hallmark of Lyme disease is migratory pain. So if you have migratory joint pain, migratory muscle pain, or migratory nerve pain, tingling, numbness, burning, stabbing, vibration sense, tremors inside, that is the hallmark of neuropathy. And if it moves around your body, where one day it's in your arm and the next day it's in your feet, that's active Lyme that's still present in your body. So, but we don't usually see, for example, I don't see lupus or rheumatoid arthritis or Hashimoto's where you get low thyroid or hyperthyroidism from that we don't usually see, but the autoimmune markers will remain for a while. Although once we have kicked down all of the bacteria and treated the mold and done this, the autoimmune markers usually will go down, sometimes to zero, sometimes to very low levels. So you have to differentiate between having autoimmune markers in your body, which are indirect markers of inflammation, versus a true autoimmune disease, right? I mean, they're like two separate things. But no, we don't usually see long-term autoimmune problems once people have done Dapsone Combination Therapy. And Dapsone's used for Behçet's, for this really bad autoimmune disease, which I believe at this point is probably caused by Bartonella. I did a published study on it about 10 years ago. And that's how we discovered pyrazinamide, one of the tuberculosis drugs we use for BART. When that drug was added, the Behçet's, the autoimmune lesions, these big ulcers in the mouth and different parts of the body went away, and Bartonella came out of hiding. That's how we discovered that particular drug. But no, I really, the autoimmunity, I found it to be quite effective. But you need to realize that the environmental toxins, the hundreds to thousands to get into our body, also cause autoimmunity, as do the wrong bacteria in your microbiome. You may not have enough Akkermansia species, your bifidobacterium, Clostridium species, your Firmicutes ratios. All of these bacteria now have been linked to autoimmune diseases, from Alzheimer's to Parkinson's to lupus. So you got to look also at the microbiome in your gut and the environmental toxins when you're dealing with autoimmunity, including, vitamin D levels and a whole bunch of other things that affect autoimmunity.
Yeah, absolutely. Yeah, the environmental toxins are a tough one, right? I mean, I think so many of us are just buckets of those things, especially if you already have kind of chronic disease and been exposed to mold and all these things that are just kind of wearing down your immune system. It's like your body just doesn't have time to work on clearing these things out. And a lot of us don't detox well to begin with. So you kind of just really fill up your bucket with these toxins and then infections and then mold. And before you know it, you can't get out of bed, right?
Right. Yeah. So it's very important. And I would say really, again, at the top of the list of these 16 points, the infections and the toxins are the top two ones that are driving the inflammation. So people shouldn't get overwhelmed. They go, oh my God, there's 16 factors. How do I know, which ones are the most important? The 3 Bs, and understand there are other infections, other tick-borne infections like tularemia, rickettsia, Rocky Mountain spotted fever, typhus, Ehrlichia, anaplasma. There are other tick-borne infections that can cause inflammation. But for the most part, if you treat the 3 Bs, Borrelia, Babesia, BART, and go after mold and heavy metals, which also show up in most people, you will see significant benefits as long as you have addressed, as I said, the hormones and the POTS, and you've gotten to sleep. And honestly, even the trauma, 50% of my patients have had some form of trauma. They've even been gaslighted by doctors telling them it's all in their head. They've been sick for so long. They need to do limbic retraining, neurofeedback, because the immune system will not work properly with that kind of psychological trauma. And we've seen tremendous benefits in people spending 6 months or a year doing limbic retraining, like anti-hopper dynamic neural retraining, the Gupta AIR technique, primal trust. There's a lot of these different techniques that are out there now to help people who have had trauma so that they don't have to live with this for the rest of their existence.
Absolutely. So you touched on some of the other infections. So we talked about the 3Bs, but then, some of these other infections. And then I feel like every year or so we're getting even new infections that we haven't even heard of, right? Like the Powassan virus is one that's kind of starting to spread a little bit more, and lots of other sorts of infections. What are you kind of seeing in your practice with some of these newer infections? Are they also responding to Dapsone, or are there other treatments that you need to do for some of these new tick-borne diseases that are cropping up?
So the problem with Powassan virus, which is a viral infection found now in the ticks, and its cousin, which is tick-borne encephalitis virus in Europe. So these are viral infections in the ticks that can be transmitted within 15 minutes of a tick bite. So part of the reason that people need to pay attention to tick prevention, and my favorite tick prevention is permethrin-treated clothing, taking your clothing outside and spraying it. You don't wear it, but spraying it with permethrin. You can buy clothing that has permethrin in it. It's a chrysanthemum derivative, and using picaridin 20% on the skin, which is highly effective for ticks and mosquitoes. IR 3535 is good for pregnant women because it's an amino acid base, safe in Europe for over 35 years. DEET is only deep woods and not for kids because there have been seizure disorders in children. Lemon eucalyptus oil also is an option for people that don't want to use, regular ones. But you've got to use tick prevention because 15 minutes of a tick on you can transmit Powassan. Now, fortunately, we don't see a lot of active Powassan. There's, handfuls of active Powassan encephalitis where you get brain swelling every year in the US. But that being said, they found that up to 16% of the people with Lyme disease in the Northeast and the Midwest have tested positive for Powassan antibodies. Now, what this means is a lot more people are getting exposed to the Powassan virus, which is a type of virus called a flavivirus. It's similar to Zika virus, West Nile, which is in mosquitoes, dengue fever, yellow fever virus. So it's similar to the viruses, but the problem is there's no cure. So if you get this, you're basically hospitalized, on a vent, sometimes on respirators, and 10% of the people die.
Wow.
So
15 minutes, just with the tick being on you for 15 minutes.
That's why tick prevention, you have to, every time you go outside, I really suggest always have a bottle of picaridin 20% on your skin, wear those clothing, and you have to do frequent tick checks. Right? When you go inside, take a shower, throw your clothes in the dryer at high heat for 10 minutes. It desiccates and kills the ticks. But they're finding, there was just a study in the Midwest that they're now finding earlier cases of Powassan virus. And, for example, rickettsia, Rocky Mountain spotted fever, that can be transmitted within 10 minutes of a tick bite. Borrelia hermsii, tick-borne relapsing fever, is transmitted within 5 minutes of a tick bite.
Wow.
So, yeah,
Doesn't take long.
That's the all-time winner among the ticks. And even though you hear that a tick has to be on you for 24 to 36 to 48 hours to transmit Lyme, there is an exception. If the tick has partially fed and the bacteria made it from the midgut of the tick into the salivary glands, and then it bites you, it's already in the salivary glands. It's going to get in a lot more quickly. So people need to realize that there are exceptions. It's not only 24 hours. You can get patients who've definitely told me they've gotten Lyme earlier with a tick bite. So, it's really important people pay attention to tick prevention. But Rocky Mountain spotted fever can kill people, right? You can have your arms and legs amputated. I mean, it's a horrible disease. And one thing that listeners should know about, the early stages of most of these tick-borne infections, Ehrlichia, Anaplasma, Rickettsia, Borrelia miyamotoi, tick-borne, hard tick relapsing fever, Lyme, most of these tick-borne infections, Babesia, will cause low white cell counts, low platelet counts, and elevated liver functions. If you're in the spring, summer, or fall, and you suddenly get a high fever, a headache with a stiff neck, light sensitivity, gastrointestinal symptoms of nausea, vomiting, diarrhea, which you might think is a virus, those are symptoms, those can be symptoms of early tick-borne infections. And people have died from Lyme carditis or tick-borne infections because the doctor thought it was a virus. If you do a CBC and a biochem profile, and you see a low white cell count and or a low platelet count and or elevated liver functions, all three can be there, you immediately go on 7 to 10 days of doxycycline 100 milligrams twice a day. You do not wait for blood tests to come back. And that includes children less than 8 years old and pregnant women. They have shown that doxycycline does not cause teeth staining. The teeth staining used to be in the older tetracyclines. You can save someone's life by a doctor putting them on doxycycline. And the one dose doxy that you sometimes hear about from the IDSA doctors, it has never been proven to work for tick prevention. If you really think you might have gotten an infection, minimum 7 to 10 days. If you think it's Lyme, it's going to be closer to 21 to 30 days. But that's an important distinction. You don't wait for the blood test to come back. If you're starting to have symptoms and you've got any of those signs on the blood test that you have been infected.
Mm-hmm. And I'm glad you brought up testing, because that's such a hairy subject in the Lyme world, right? Like, we still don't really have like a good test to see if you have Lyme. A lot of people, when they just go to their primary care after suspected tick bite, they're going to do just the ILADS test, which misses over 50% of Lyme cases. It's a coin flip, and a lot of times that's testing your antibodies, right? So if you test too soon, your body may not be making antibodies. So you're going to get this negative test, think you're in the clear, and then a couple of years later, realize, hey, I've been sick for 2 years. It must have been that tick bite. So, and that's if you're lucky, right? A lot of times people go longer. So you've been in this world a long time. You've seen a lot of slow progress in the Lyme testing, and there's some newer tests out there now. What testing do you feel like is the most kind of accurate or reliable test that we have in the Lyme world right now, that if people do suspect they have tick-borne disease, that they should be using this type of testing?
So the first thing that people should know is I have a validated symptom questionnaire that is on my website. The website is www.cangetbetter.com, all one word. If you look under symptoms, you'll see the validated symptom questionnaire. You can download the PDF of the questionnaire, fill it out. If you have a score over 63, there is a very high probability that you suffer from active chronic Lyme disease. So it's important to know that. And on the questionnaire, you'll see questions like, do I have migratory joint pain, migratory muscle pain, migratory nerve pain, the hallmark of active Lyme? And people should know there's only 6 other diseases in medicine that cause migratory pain. And I used to joke with doctors that unless you graduated at the bottom of your medical school class, you would know the difference between acute rheumatic fever, acute gonococcal arthritis, having Reiter syndrome, which is from like Salmonella Yersinia in your gut with infections that go on to like your fingers get very swollen, having hepatitis, or having inflammatory bowel disease like Crohn's or lupus. Those are the only 6 other diseases. And honestly, they don't really look like Lyme. Lupus is probably actually one of the closest because it has all of these itises, these inflammatory manifestations all over your body. But if you score high in the questionnaire, it tells you there's a high probability of Lyme. If you're like between 42 and 62, there's a moderate probability. If you're between 25 and 41, there's some possibility. Below 25, it's not likely you're going to have Lyme. Now, if you score high in the questionnaire and you're thinking you have it, I go directly to a Lyme immunoblot, IgM, IgG, through IGeneX Laboratories in California. Why? Because there are at least 8 major strains of Lyme in the United States that cause people to be sick, and you'll find those 8 strains on the Lyme immunoblot. If you do a standard ELISA or a standard Western blot from Quest, LabCorp, or any lab, you're only going to check one of the strains. So how are you going to possibly pick up Lyme if you've got all these different strains? You need a test. That is a broad testing strategy. But you don't use CDC criteria to diagnose somebody with chronic Lyme, and that's where doctors make the mistake. If you go on the CDC website, you will see, I haven't gone on in a while, but at least when I
does it still exist?
No, that's a good question. When I did go on, it used to say that the 2-tier testing of an ELISA followed by a Western blot is primarily for health departments to epidemiologically screen large populations, not for an individual diagnosis. So if you've got the symptoms of fatigue, migratory pain, headaches, light sensitivity, sound sensitivity, dizziness, brain fog, memory, concentration problems falling asleep, waking up frequently in the middle of the night, anxiety, depression. It can even present with OCD and psychosis with schizophrenia, chest pain, palpitations, GI symptoms in some cases, right? If you have all of these symptoms and you see any one of 5 bands on an immunoblot from IGeneX, and the IGeneX immunoblot it's recombinant DNA. There's no false positives. So a 23 outer surface protein C, 31 outer surface protein A, 34 outer surface protein B, 39 or an 8393 band. Those are the 5 specific bands for Lyme. Any one of those bands, if it shows up in an immunoblot, you have been exposed to a Borrelia species. You don't need the 2-tiered criteria. So that being said, yes, the testing does need to improve, but I will tell you, in all my years of practice, I've never had a problem diagnosing somebody with chronic Lyme. It's all about doing a differential diagnosis. You've got to make sure you rule out other overlapping diseases. But honestly, because up to 95% have migratory pain, if you think about it, yeah, I mean, if you think about it, if you know how to ask the right questions and you know the lab test to go to, right? Now, is it possible IGeneX going to be negative? Of course, it's possible because you might be immunosuppressed and not make antibodies. But honestly, in most people, it does eventually show up. And of course, there's newer tests. In fact, there's a test that's going to be coming out in the next year from Arizona. It's called LymeSeq, SEEK, which is going to be able to diagnose earlier Lyme. And this is something we've really needed for a long time. But you can also find like direct testing where they'll look for the OspA antigen in the urine. Galaxy Laboratories kind of picked up that on that particular test. Galaxy has a great profile for, checking all these different Bartonella species with PCR. T-Labs, great lab for a Lyme PCR. 2 Babesia strains, Babesia and Babesia oticolii, the new kid on the block. It's the only lab that specifically checks it, although the Babesia fish from IGeneX will pick it up. And they do a great Bartonella fish. So I have found that if I mainly stick with IGeneX and T-Labs, I can't do Galaxy in New York, otherwise I would be using a lot. And even Vibrant Laboratories, they check for 6 strains of Lyme and the rest. You will find if you use some of these labs, you should be able to establish the diagnosis. But remember, it's a clinical diagnosis. You don't rely on the lab test to do it. But also remember that if you've had COVID, you might have a viral reactivation that's still causing your fatigue and mold toxins still causing your fatigue and your brain fog. Like, you still have to realize that these overlapping inflammatory factors on the 16-point MSIDS model, you got to keep going back to the 16-point MSIDS map and going, what am I missing if I'm still not well? Because you will find the answer usually will be there.
Mm-hmm. And that's such a good point too, right? Because we don't really have a Lyme test right now that's kind of tracking your progress or telling you when you've cleared it out, because these tests just really don't work that way or look at those things. So at a certain point, you're like, is it Lyme? Is it mold? Is it something else, like a reactivated virus? Like, you don't know what to kind of go after, right? So you don't really have this testing to guide you. So how do you really differentiate where you should put your energy into?
It's a clinical diagnosis. So if someone says to me, after doing, let's say, Dapsone Combination Therapy and a couple of pulses of BART, that they are asymptomatic, which I hear from people. As I said, my wife's 7 years remission. There's a UCLA student I just spoke to yesterday. She is 3 years in remission. She was sick for many, many years. She's come out and told her story from the Live Lyme Foundation. Olivia, she's come out and she has a book out about her story. There are people that definitely will go into long-term remission with Dapsone therapy and the rest. But, you still have to look. So if someone says to me, I no longer have the migratory pain, but I have night sweats, I have day sweats. Well, those are malarial symptoms of Babesia. So then I may say, all right, gee, I haven't checked a Babesia fish test in a while. Let me send it to T-Labs or IGeneX and you'll find Babesia. You might get lucky with a 10-day course of Mepron and Zithromax, but Babesia microti has now become resistant. So the newest protocol is tefenoquine. And you might use tefenoquine with Malarone or Mepron. But the point being, it's based on symptoms. And the T-Labs test, for example, finds Bartonella in a lot of my patients where I have to keep pulsing these 2-week pulses every 6 to 8 weeks. And again, it's like peeling an onion. Someone will say to me, every time they do a 2-week pulse, a level of my fatigue and my pain and my brain fog gets better. If they don't, then I have to go back and say, hold on, is the mold gone? Let's look at real-time laboratories in Texas and give them 2,000 milligrams of glutathione, get them in a sauna for 15, 20 minutes, drinking fluids, check their urine test, see how much mold they have. And honestly, I found in some of these people, as the mold got detoxed, what I thought was Lyme and BART, all of a sudden it wasn't. It was the mold toxins that was overlapping the tick-borne symptoms, right? So it's very important to constantly do a differential diagnosis, going back to the top factors, which is Babesia and BART with Lyme, going back to mold, checking for long COVID. There's a test through Bruce Patterson's Radiance Diagnostics. It's COVID long haulers with an S. And you do the 14 cytokine panel. And if you see an elevated VEGF, vascular endothelial growth factor. Well, either that is active Bartonella, which is inflaming your vasculature, or you've got spike proteins from the virus that's also causing inflammation, or it's both. Right now, the problem with long COVID is I've not had great success with Miravirac and atorvastatin, which is his protocol. And I'm now starting to look at the FLCC alliance with like nicotine and serrapeptase and ways to get rid of the spike. But there's no published scientific studies in large groups of people validating this. So all the billions of dollars the NIH put into long COVID, I still can't go to the literature and go, what is the most effective protocol? And that is just a crying shame. And I by the way, and I contacted RFK Jr. I supposedly am going to get a meeting in Washington in the near future. I contacted one of his childhood friends that has gotten people in to see him. And I'm going to discuss with him chronic Lyme because he's talked about publicly that he's had it and his family has had it. I'll talk about also he wants to fix the chronic health epidemics in this country. I have a new book from Simon & Schuster coming out next year on all the chronic illnesses in the United States and why we stay sick. It's the ABCs of chronic disease medicine, from why people are getting autism to Alzheimer's to allergies to ALS to chronic fatigue syndrome, cardiovascular issues, cancer. I'm addressing all the big issues. And guess what? The 16-point MSIDS model shows up in every one of these chronic. It's unbelievable. Like, nobody knows this, that it doesn't matter what you name the chronic disease. We're finding it's the microbiome of your gut. It's bacteria, it's viruses, it's environmental. And right now, the way we practice medicine is name the disease and throw a drug at it when it's too late and people are disabled. So, my approach to this is, if you're looking to save money at the federal government, and we know that 85% of our healthcare costs, 18% of our GDP is healthcare, and 85% of that is chronic disease. And we don't have a model for chronic disease in this country of how to address it. So we need chronic disease centers of excellence for these people with these chronic illnesses, where we check the mold and we check the 3Bs. We need to train doctors in the protocol I've been developing. And I have a training website, Can Get Better, has videos where I tell doctors, how we do this. We do train them. But the fact is we need a whole new shift in the paradigm of how we treat chronic illness, from prevention to how we treat these chronic diseases. And that's going to be the focus of my next science book. It's, I hope it'll be the paradigm shift we need for this country. I think so, based on having done a deep dive in the medical literature.
Yeah, absolutely. Yeah, there definitely needs to be a shift, because everyone I talk to has some sort of chronic condition at this point, right? And you're always just like wondering, you're like, what's going on? Do they have Lyme, mold, viruses? Like, you always know that that's one of like the root causes for pretty much everything, I feel like, at this point. So absolutely important work to be doing there. So we have time for one more question. So you've been in this Lyme world, obviously, for a long time, over 40 years, and you're doing some amazing work for everyone in the Lyme community, and, trying to find a cure for us. Do you think that Lyme is ever going to have a cure? Are we ever going to have a test that tracks our progress and can tell us that we're cured of Lyme? Or is this something that you're always just going to have to manage at some point? And hopefully the Dapsone kind of keeps it in check and fixes a lot of things, but are you still going to have to kind of, in the back of your mind, worry that you have this infection living in you?
Well, so you're asking at this point, of course, a very important and unanswerable question. But in the mouse model that Tufts did, rifampin and Dapsone cured Lyme. I now have patients for years in remission that the symptoms have never come back. And that's with getting COVID, getting the flu, having all kinds of illnesses. Now, normally when you've got a low load of the bacteria, I know Dapsone lowers the load of the bacteria, because in culture, as you keep addressing it and adding antibiotics, you can actually see the biofilm persister go down over time. So, it's possible in some people there is a cure. It's possible in some people, and I believe Bartonella, by the way, Lyme, by the way, is much easier to cure than Bartonella. I will tell people this right away. If you don't have Bartonella and you don't have Babesia, the 9-week Dapsone protocol, if you don't have mold and things, you're going to feel pretty good when you're done with this protocol. But it's why we need a randomized, multi-center, randomized, placebo-controlled trial. But that being said, I do think some of these people have been cured because they've gone for years without symptoms, without ever relapsing. And you can hear those on the Dapsone documentaries that are from the Dr. Talks Healing Lyme Summit last year. And the one that, again, will be April 15th to April 22nd, where you'll hear the next Dapsone. So there is hope for the Lyme community. I think many may be cured. But again, we're not going to biopsy people to find it, right? We can only do this in animal models, right? But regarding what's not easily cured, it is definitely Bartonella. Bartonella is showing up in 90%, and I have to use multiple pulses of Dapsone, these 2-week pulses. But again, after I do that in a certain number of people, they will go into long-term remission. But it's always the mold. It has always been the mold that interferes with the success, even of these 2-week pulses for Bart. And in some people, I'm still treating them. Like I still have some that are ill because the mold is not yet gone and the Bart fish keeps coming back positive. And whereas we check the immunoblots and we don't see any of the bands on the immunoblot anymore for the Lyme, but we do see the Bartonella playing a role. So I think people need to realize that Bartonella looks like Lyme, it smells like Lyme. The difference is you get pain in the bottom of your feet that can be very severe neuropsychiatric symptoms, usually worse than with Lyme. Very severe neuropathy, tingling, numbness, burning, very severe POTS. Those are an immune deficiency. Those are classic with Bart. But Bart is much more difficult to treat, but it is treatable. So there is hope for the Lyme community. It's not like I get every person in my practice better, but honestly, over 95% of these people get their lives back. And it's really only the ones that have chronic Bart and mold that I'm just working on, or they have long COVID where we don't have an answer yet, a good answer. And according to some of these, websites out there, it takes a year of this new long COVID protocol to get them better. But that doesn't mean that what I've been doing is not effective. It just means there's 1 or 2 nails left in the bottom of the feet that we're still working on at this point. But it doesn't mean we won't get there. It just means that science and medicine needs to advance where we just find more effective protocols for these.
Absolutely. Awesome. Well, Dr. Horowitz, thank you so much for sharing all this amazing information. So we're going to link to everything. We're going to link to your Substacks and your questionnaire, everything that you sent over so that people can link to that and check out more information with everything we talked about. So I appreciate you so much. Thank you.
Thank you, Erica. It was a pleasure to be here with you.
Thank you.